The next topic we have is melasma, which really deals with the pigmentation cells in the skin. Next slide. Okay, melasma is a common skin disorder, loosely translated. The word means black spots. If you have melasma, you're probably experiencing light brown, dark brown or blue grayish patches on your skin. They can appear flat patches or flicker-like spots. Commonly affected areas including your face, cheeks, upper lips, and forehead, and as well as your forearms. Melasma sometimes is called the mask of pregnancy because it usually happens to pregnant women, usually because of the hormonal changes that women go through. And there's hormonal stimulation that can cause melasma. And it typically gets worse in the summer and better in the winter. Next slide. Where does it happen? As we said, it mainly happens in the cheeks, nose, chin, and above the lips and the forehead, usually just like in the face generally. It sometimes happens in the arms, neck, and back. In fact, melasma can affect any part of the body that's exposed to sunlight. The two main causes of melasma is radiation or hormonal changes, and any of these two can cause melasma. Is it common? It's common amongst pregnant women. 15 to 50% of pregnant women get it, and between 1.5% and 33% of the population may get melasma, and it happens more often during a woman's reproductive years. It usually starts between the ages of 20 and 40. Next slide. Risk factors that people need to look out for. People with fairer skin are less likely to be affected with melasma than those of darker brown skin and those who tan well. Women are more likely to get melasma than men, and pregnant women get melasma more often than anyone else. Next slide. What happens? What is happening in the skin that causes these dark spots? Well, basically, you have these melanocytes that store and produce pigmentation. It gives you the color of your skin. And what happens is, in response to light or heat, in response to either radiation from the sun or tanning beds, if you ever use tanning beds, and hormonal stimulation. And this is why it's more common in women. These two things can cause these melanocytes to produce more pigment, more melanin, and makes your skin darker. So yeah, so it's just it's stimulation basically that causes these dark spots to occur.
There are three types of melasma, and they have to do with the depth of the pigment. A wood lamp that emits black light may be used to determine the depth of the pigment. The three types are epidermal. Epidermal melasma has a dark brown color, a well-defined border, appears obvious under black light, and sometimes responds well to treatment. Dermal melasma has a light brown or bluish color, a blurry border, appears no differently under black light, and doesn't respond well to treatment. And there is mixed melasma. Mixed melasma, which is the most common of the three, has both bluish and brown patches, shows a mixed pattern under black light, and shows some response to treatment. As we said, two causes of melasma, which are hormones and radiation. Melasma is hard to treat. To determine a treatment plan, your healthcare provider will have to first figure out what's possibly causing the melasma. Is it sunlight, your birth control, genetics, your soap, too much screen time? Depending on the person, melasma may go away on its own. It may be permanent, or it may respond to treatment within a few months. Most cases of melasma will fade away with the time and especially with good protection from sunlight and other sources of light. Unfortunately, there is no definite treatment that will automatically make melasma disappear. At this time, there is no way to remove dermal pigment. If you have melasma, be sure to avoid hormone treatments, specifically ones that involve estrogen, birth control, specifically oral contraceptive pills that contain estrogen and progesterone, LED lights from a television, laptop, cell phone, and tablets, makeup you find irritating to your skin, medications that may cause or worsen melasma, scented soaps, skincare products that irritate your skin, tanning beds, waxing, which can aggravate the melasma. Does melasma go away by its own? Yes, it's possible that your melasma will go away on its own within a few months. However, it is not likely to go away while you're pregnant or taking hormone contraceptives. Take preventative steps like avoiding sunlight to keep your melasma from getting worse or to keep it from coming back. Melasma can return.